Shari, thank you for joining me this morning as we talk to leaders of Woodruff Health Sciences and chairs of our departments across Emory and certainly Children's Hospital. You are the new chair of pediatrics and of course the head of the Pediatric Institute. How long have you been here, and maybe just share a little bit about yourself?
Well, I have been here 2.5 months. I am delighted to join this remarkable community. When I describe myself as a pediatrician, as a health services researcher, as a health outcomes researcher, and a mother.
Yeah.
What is more important than helping children to achieve their full potential?
Yeah.
And as a pediatrician and a researcher and also a leader, you have the opportunity to look at prevention, at early intervention, at changing trajectories away from disease and towards health, and lifting up teams of people to do that well. So there's really no better job than that.
Yeah. I remember listening really to an incredible presentation you made either just before you started or when you started to the Pediatric Institute board. You talked about your passion in the area of obesity. Tell us about your research.
Well, I love talking about research. I think that you're inspired by your patients first and foremost. So in the early 2000s, I really saw the obesity epidemic tip at a macro level, but not equally for all of my patients. It was really affecting more of my patients with lower socioeconomic status. And that made me ask why. It wasn't sudden gluttony or sudden sloth or how we use social media. Actually, the iPhone hadn't even been invented yet. So then you ask why. This is what's great about being a researcher. You're driven by your curiosity, and the curiosity comes from problems that you hope to solve that will improve outcomes, and in my case, for children.
You know, just seeing the new building, of which I've had the good fortune of touring, immediately brings hope, I would imagine, to families with children that are suffering.
We have this magnificent Arthur M. Blank Hospital, which is 2 million square feet of the latest and greatest for what we can do for children.
Yeah.
We also have Scottish Rite, which has been in this community for a very long time.
Sure.
And is contributing in important ways to advance high quality care. And then we work, of course, with Grady at Hughes Spalding.
Right.
All of these things together make us stronger. When you walk into a building, you're inspired. But when you meet the people that provide the care, that's truly when you understand what's special about Children's Healthcare of Atlanta.
Yeah, and I remember just recently you and I spoke about gene therapies, thalassemia, sickle cell, and I know Children's is working on offering that to this community literally this year.
That's right. So gene therapy is one of those things where you feel like it feels like science fiction. Can we really do that? Can we just sort of snip out part of your genome that's causing disease and then cure a disease? That seemed really implausible in the recent past, and yet we've now seen it bear out to be true.
Yeah.
That a child comes in with sickle cell and they leave the hospital without sickle cell.
Right.
It's remarkable. So when you come to a place that's renowned, that has the capabilities we do at Children's Healthcare of Atlanta, you're able to participate in the research to advance the discovery, and then you're able to actually deliver that discovery as a new standard of care.
Yeah, that's remarkable. Now, Shari, you're the chair of the Department of Pediatrics here. There are a few other chairs at Emory as well, right? There's medicine and surgery and so forth.
Sure.
What's been your interaction in the last few months with the other chairs that you sit at the table with?
Well, a big reason why I wanted to come here wasn't only for the phenomenal work that Children's Healthcare of Atlanta is able to contribute, it's the partnership with Emory. The chairs that I've met have been so incredibly welcoming, and the opportunity to interact and to think in deep, multidisciplinary ways, that actually is something that allows you to solve problems differently.
Children's healthcare is also a magnet for trainees. I know individuals who want to train in pediatrics from around the country want to come and train at Children's Healthcare of Atlanta.
You know, often we talk about how we take care of children and we take care of how we advance discovery. none of this actually could be sustainable if we're not training the next generation to do these things as well.
Right.
And honestly, they train us too. The time has never been more critical than it is now.
Now, the Department of Pediatrics rivals, I would say, the Department of Medicine in terms of research funding as well. There's a tremendous amount of research that goes on in the Department of Pediatrics. And
That's right.
share with us what are one or two highlights in the department.
One of the areas that's very exciting is cellular therapies. That's using your own cells as your medication. And the process for how you do that, it has been so refined that now we can do remarkable things for children who've had relapsing cancer, where it seemed that there was nothing we could do to intervene.
Yeah.
When we look at other issues that are really important that are facing children, we think about autism and the prevalence of autism that has increased over time.
Sure.
We're doing research here that pushes the boundaries for innovation, for early diagnosis, and then we're looking at interventions and how we build up interventions. These are examples of the problems that children need us to solve,
Yeah.
and research is one of our tools in our toolkit to do that.
No question. I think just like myself, people watching this can see and hear your passion in research and in caring for children. We're incredibly thankful about the fact that you're here, you're a leader in our organization, and we look forward to working with you in the years to come. Appreciate your time.
Thank you. Looking forward to what's next.